Of course, the epidemiologists and all the important medical people who need to tell us about these things must tell us where they're finding this. But did the reporting of it around MSM raise your eyebrow?
Good morning, Jim, you and your listeners. Yes, indeed. We're not denying that it appears to be a largely MSM-focused outbreak at the moment overseas. Bearing in mind, we don't know if the individual in South Africa is MSM, man who has sex with men. But what we're saying is that it's not okay to use this to discriminate or stigmatize a group of people because of it. And as you mentioned, we need to have learned something from the HIV epidemic.
Because, of course, part of why the eye was off the ball, so to speak, about that pandemic, initially at least, was precisely because of this kind of framing.
Indeed. And as we've seen, it may have initially been reported amongst gay and bisexual men in the US and in Europe, but in Africa, for example, HIV/AIDS is primarily a heterosexual disease. So, diseases don't care about sexuality, they don't care about your behavior, and they certainly don't care about so-called morals and values.
It's already being derisively called the gay pox, and likely could lead to some harmful stigma.
Yes, indeed. And really what we're asking is that the health authorities give context and spread the message that stigma and blame is not okay. And we really want government or any messaging around this to educate and avoid generating stigma. People really need to be aware of the potential impact of their words.
Appreciate your time, Louis de Barrow there from Out Magazine. Let's join now the conversation with Professor Adrian Pirenne, who's the Executive Director at the National Institute for Communicable Diseases. Prof, always a pleasure to have you on the show. Before we get into the nub of what we're going to be dealing with, I just want you to respond to the concerns I raised with Louis there.
Certainly, it is also of concern, especially if we know that in this particular instance, it certainly is by coincidence, really, that, in fact, this virus has found traction in particular social and sexual networks. But it's really critical that we don't stigmatize, and I think we have certainly condemned any attempt to do so, because, again, it's important that people who are experiencing this particular infection or disease actually do seek health care, and it's really critical that they do so in an environment that is safe. And I think it's also important that in terms of controlling and managing this particular outbreak, that people are able to present and that we can do the appropriate tracing and tracking, because that's going to be key for South Africa in terms of managing any further spread of this particular infection.
Because, of course, quite apart to the harm that might be aimed at a particular community, what it also raises the danger of is people saying, oh, it doesn't affect me, and therefore not being as vigilant as they otherwise would be.
Absolutely, and I think that's very important. It may have occurred in specific sexual, social networks, but then it can spread across other networks. So, I know that currently the main focus has been where males have sex with men and bisexual men. That certainly is key for the epidemiology, but it can certainly go across into other networks, and if we don't control it, those networks can also be affected. So I don't think we should be complacent and try and stigmatize individuals because of this particular infection.
Right, let's get straight into what monkeypox is then. From what I understand, it's endemic to Central and parts of West Africa, and the reservoir host, the main disease carrier, is known to be a set of rodents, but also amongst some primates.
Yeah, so that's how it has actually been described. So it's really a zoonosis that does not often cross over barriers, but it's certainly in specific areas in Africa it has crossed over barriers, and that's how it was discovered. But I think what is different now is in this particular outbreak this is one of the largest outbreaks where there is no evidence of a zoonotic spread. In other words, it is person-to-person spread. This virus is not highly transmissible compared to, say, COVID-19 or measles, but certainly prolonged exposure, and that can be either face-to-face contact, it could be, again, via sexual contact or within clusters and homes, where there is the sharing of specific common areas, including exposure to clothes or bed linen and so forth, that this particular virus can be transmitted. Again, compared to COVID-19, this virus does not have severe outcomes, except possibly as a consequence of the rash. But there are rare instances, especially in pregnant women, younger children, and those that have immunodeficiencies, where you can have poorer outcomes.
Like a fatality?
So again, the fatality, I know that there are reported fatalities based on the clade. So this particular clade that's currently in circulation is thought not to be a more severe form of this particular virus. And so-called reported case fatality rates are about 1%, and the other one is about 10%. But in this current outbreak, I think the case fatality rate is approaching, I think, 1 or 2 cases at least. So again, it's very, very different to what has been reported previously. And that may be because of the nature of this particular outbreak.
Well, you've told us about, the rash on the skin, right? I believe it's a blister-like rash, but also you can experience fevers and general flu-like symptoms.
Yes, that's correct. So it can have a fairly lengthy incubation period, up to about 21 days. It can be shorter, to about 2 weeks. And what happens is you have what is called a prodrome. So it presents with a fever, severe muscle ache, and a feeling of tiredness and exhaustion, and then followed by about 3 days later a so-called rash. And again, this rash, the presentation can be variable, but and it could start in the face and spread across the body, hands, the anogenital area, for example. Especially now in this particular setting, the anogenital area is of particular relevance, but it can be variable, and so we can miss it. In other words, we need to be alert and be aware and educate ourselves that it is possible, and of course exclude any other possibilities for this type of rash. And I must also emphasize that in terms of transmission, it's thought that while you have this rash, and until you have healthy skin, transmission can occur. So it's really critical, again, when we're thinking about contact and close contact, as well as shared spaces, what we need to do under those particular circumstances.
So basically, from the onset of that rash, an infected person is contagious?
Absolutely. So isolation is going to be a key component. So once a person has been identified, confirmed diagnosis, our view is that isolation is really going to be critical. Again, if there are shared spaces, again, that those need to be managed as well.
How's it diagnosed?
So currently, although the rash may be the presenting feature, it's important to exclude any other possibilities in case the rashes appear similar to any other infection, such as chickenpox, for example. So it's confirmed by what we call a molecular test. It's a polymerase chain reaction, and this is currently offered at the NICD. And based on what happens in the future, this may be provided by other laboratory providers within the NHS and the private sector. But PCR is the key feature. But I think what is important from my perspective as well is that we have a good history in terms of the presentation in order for us to assist in the diagnosis. And once that is made, I think really critical then is the forward and back looking in terms of contact tracing to identify further cases so that they can be diagnosed and managed and any further transmission stopped.
And how is it treated?
So because this is a relatively so-called mild disease, I think it's primarily symptomatic treatment at this time. If you've been fortunate in the sense of a specific age group and have had the smallpox vaccine, you may have a certain level of protection, but it's really symptomatic treatment. Of course, if there are severe outcomes, then hospitalization would be key. We do not recommend, and I don't think WHO has recommended this either, as mass vaccination, again, because the stocks are probably not available and limited. There is a specific monkeypox vaccine as well, but again, access and availability is difficult. And there are certainly antiretrovirals, but again, access may be problematic. So it's really, because of the nature of this disease, it's really symptomatic treatment at this time.
Prof, let's end where we started. Yesterday, we heard, of course, from the Minister of Health, Dr. Joe Phaahla. I even heard from someone like Professor Koleka Mlisana, both of them framing this issue. And I'm not pointing a finger of blame at them at all, but framing the issue around this MSM issue. How do we have conversations about an outbreak like this without going there?
Yeah, I think it's really important, again, that we understand, that we want to understand this particular disease. And I know it's a very delicate area, not only in South Africa, but worldwide, that we need to avoid the stigma. We really need to say this is a disease. It can spread. We're all susceptible. I know that the majority of the cases so far have been identified as MSM. However, that's a proportion and a significant proportion. But there are other social and sexual networks that can be affected as well. So I don't think we can certainly try and pin blame. And I think that's really critical that we acknowledge we have a human rights culture. We should adhere to that and enforce it and not stigmatize any individual because of their sexuality. Because if we drive this underground again, then we're just going to have continued transmission, which is going to be difficult to control. Because again, we don't know how this will unfold in South Africa. We may have another unique unfolding compared to Europe or the UK. So it's really important that we put central to this is how do we manage this and how do we manage our individuals rather than a particular or sexual orientation.
As always, appreciate your time. Professor Adrian Pirenne there, the Executive Director at the National Institute for Communicable Diseases.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.